Welcome to Financial Planning Explained. I'm your host, Mike Menninger, certified financial planner, owner, and founder of Menninger and Associates Financial Planning. I'm pleased again to have Cheryl Lagunilla with us today for the second episode of Medicare. As I pointed out in the introduction of the first episode, I can't stand Medicare. It's an annoying thing, but it's a necessary evil, and actually, it's actually a very good thing. But the nuances and it's administrative, governmental, bureaucracy, red tape, every other term that you could possibly use, and absolutely confusing. But as I pointed out in the first episode, I only met Cheryl a couple days ago for the first time, and I was flat out not only impressed with her knowledge, but the way she behaves from the perspective of truly serving as an advocate for the individual and not a representative of the government, thank goodness. And that immediately, ironically, I had two situations literally that day where I literally said to each of those two people, I need to find you a Medicare advocate. And look who shows up at my door in the afternoon. And she actually reached out to each of them and is untangling a lot of misnomers and messes that are in questions and everything else. So again, I thank you for that. What we're going to talk about today, and we could get into other scenarios, or case studies, but just kind of talking about how do you enroll? What is it? Maybe we step all the way back and say, what the heck is Medicare? But then go into, because you got Medicare Part A, Part B, and then supplement, there's D and all that crap. Give the real 30,000 foot level. Tell me about Medicare.
Okay. At its core, when people ask me, what is Medicare? I just say it is government run. It's federally run insurance that you have earned through payroll deduction. If you contributed for 40 quarters or 10 years into the Medicare system, you're entitled to Medicare, A, free, and B, there will be a premium. But it is just government run health insurance.
Right.
At its core.
So Part A is free. Okay, it's given to you. That's basically hospitalization, correct?
Facilities, so skilled nursing,
right?
Home health.
Okay.
Yes. Mm-hmm.
Part B is your doctors.
Yes.
But then most people, upon our recommendation, people are used to saying, all right, well, I had a great plan at work, and now all of a sudden I'm on Medicare. I say you get Medicare supplement because it kind of fills in the gaps. And between Medicare Part A, Part B, and whatever the supplement is, basically mimics full coverage, right?
Yes. You could say that. Original Medicare, when you hear that term, that's the thing you go into, what you paid into the system. That's A, that's B. Mm-hmm. Pays 80% of your cost with people who accept Medicare. Fortunately.
That's Part B.
And A.
Okay.
Yeah. Fortunately, that's 98, give or take 98% of doctors in the country. Now, depends where you live. I noticed in New York City, my clients, there are a lot of doctors that have opted out. So when we're working with a client, we want them to know, yes, this is excellent coverage. It's health insurance, government runs it, but we want them to understand that although 98% of doctors accept it in facilities, some may be non-participating.
2% don't, right.
Yeah. Ask, do you take it? If they say no, the question is, are you non-participating or have you opted out? If they have completely opted out, you're going to pay 100% of the bill. If they're non-participating, they reserve the right to charge you with a cap up to 15% above the Medicare rate. And it's just good to know for people who want to know what to expect when they're choosing a provider.
But Medicare will pay that, and all you're really coming out of pocket is that 15%.
Correct. Unless they've opted out. Now, this Medicare, A and B, covers 80%. What about the other 20%? On traditional insurance, you're used to a max out of pocket. I call it your worst case scenario. Basically, up to this dollar amount, your max out of pocket. Once you've hit that, the plan is paying 100% for the rest of the year. It usually runs January to December. With Medicare, that 20% you're liable for has no max out of pocket. That's why we advise people to pick something up that works alongside original Medicare to cover that 20%. Because that could be a lot depending on your situation. You leave yourself
Yeah,
liable.
you're tapping in the putt and the reality of it, and I don't want to get into it in this episode because that's where people can talk to you. But
Yes,
you've got a lot of different options, not a lot, but
correct.
3 to 5 probably.
Yeah. You've got Medigap, you've got Medicare Advantage. We will talk about that another time, but they work differently, and whoever's working with you should be explaining where the risks are, what you're out of pocket, what your
Absolutely.
liability should be.
So again, that goes back to you really want to be dealing with somebody who is very familiar with the ins and outs of the different plans because of the fact that, and I take, for instance, and it's individualized. So you may have a husband and wife. The husband goes to the doctor all the time, takes no meds. And then you got the spouse who may never go to the doctor, but taking 6 or 8 meds a day. So what plan works for each individual is something that you want to be able to talk to someone who knows it very well and is able to work with you very closely to identify what are your potential needs, what are the different advantages and disadvantages of each plan to help you make the decision. That's kind of what we do all the time, to empower you to make the best decision for yourself.
Yes. And at the end of the day, it's your dice to roll, I say. You know the risks, it's been played. In our industry, agents are not supposed to steer or make a decision. I have clients all the time say, well, which one would you take? Because they still are kind of
Yeah.
and I tell them, you know, it really depends on, I can advise to a point, but I cannot steer them. The good thing is, what if they took an option, say Medicare Advantage, and they weren't happy with it? See, when you first can get either option, there's no medical underwriting. You're guaranteed to be issued. There's never medical underwriting and Advantage plans, but Medigap does not medically underwrite you. Took the Advantage plan. You're in the first 12 months, Medicare protects that beneficiary by saying within that first 12 months, you can change your mind and still get the Medigap guaranteed. So you still have that option to get.
For 12 months.
After that 12 months, if all of a sudden you have cancer or heart disease, you have to.
One of them is irreversible after 12 months. And the reality of the situation is, gosh darn it, they need to know what they're getting themselves into because usually you don't know until after 12 months, are you in the right or the wrong plan?
Yes. And that's not to say that I don't have a number of clients on Advantage plans, decades in, enjoying the benefits, liking it, but they need to know that and make that decision for themselves.
Right.
And know what they're getting into either way.
Right.
Yeah.
So Medicare basically is, as Cheryl had pointed out, it is a governmental organization. I always refer to it as a sister to Social Security. It's actually the daughter of Social Security. It used to be combined. Social Security began in 1935, and then in 1965, and it included Medicare. And in 1965, Medicare broke off, but still, you used the word front door. If you want to contact Medicare, you have to start with going through Social Security. But it is eligible once you turn 65, or if you're considered Social Security disabled, 2 years after that determination, you can then go on to Medicare.
Correct. If you get, and believe it or not, I have 2 clients with this ALS or end-stage renal disease, you're instantly put into Medicare.
Really?
Yes.
Okay.
And if you're over 65, you can get it too. But you want to make sure if you're past 65, you still have creditable coverage through an employer. If your employer is under 20 or less, then you do have to get Medicare.
You have to get Medicare. Now, help me with something, because literally my brother turned 65 yesterday.
Oh, my.
Okay. Now, help me with my confusion on this. I believe you have to notify Medicare even if you already have coverage, because if you don't, then you're going to be paying a penalty for the rest of your life. Clarify that thing with me.
Not necessarily true. Say he says nothing. Now, he could just get Part A, which covers the facilities because he already paid for it. If he is, one thing, this is a little off a bunny trail, but if he's contributing to a health savings account, he does not want to pick up A. because he will have to stop contributing 6 months prior.
Okay.
Right. You said he just turned 65. He can make a decision for the month of his birthday, 3 months before, 3 months after. So he's still in that initial election period.
Okay.
So he can do that.
But if he has medical coverage at work.
And his employer, I take it, is over 20 employees?
Yes.
He doesn't have to do anything. And he doesn't have to notify Medicare. What happens is, say, 6 years down the road, he says, I'm going to retire. I'm going to retire in a couple months. Then what he will do is employer proof of coverage form. He will get that filled out by his HR department or his employer and submit it when he applies for Medicare. That's what shows them that he had credible coverage. If you don't do that, and it can be uploaded and you do your online enrollment in Social Security, if he doesn't do it, they have no way of validating that he had creditable coverage. All he has, that one simple one-page form signed off by his employer, submit it. That's it.
So under what circumstances is it, and I hear about the penalty for life, under what circumstances are people exposed to the penalty for life?
Say you had I'll give you an example. You had under 20 employees. It doesn't mean that all had to be on their insurance. And you work for a small engineering firm, it's under 20. You didn't take Medicare, 2 years, 3 years have gone by. Now you're retiring, you go on Medicare. That wasn't considered creditable coverage. So those 3 years, 1% a year, you're going to be levied a penalty, and it's to the end. I mean,
Is it 1% per year?
Yeah.
That's not too bad. I thought it was a lot worse.
Unless you're affected by IRMAA and pay more than everyone.
Well, that's a separate issue.
But separate issue. But say based on the 206, yeah. So it's not too bad. And some people don't know that rule. Sometimes the small employer knows it and will tell them. Or say, I've actually had a client that liked her Montana plan. She took the marketplace plan. She was over 65, 10 years. And I'm surprised because a lot of times they won't let you have that plan if you're Medicare eligible. I don't know how it happened, but she had 10 years of the penalty.
So it's 10% on all your Medicare premiums for the rest of your life.
And for her, unlike somebody leaving employer coverage, she couldn't just jump on Medicare. You can't just jump on it. You have to have an election period. She had to wait to what's called the general election period, January through March, to apply. Used to be when you applied in January through March, it wouldn't start till July 1st. So there's all these. That's where it gets a little twisty. There's all these little dates and rules, and even though I've done this for 18 years, I still verify my roles right before I tell someone something. It's
tricky. Well,
it's a lot.
It's what we always say: he who knows the rules of the game generally does better at the game and has an edge. And it's when you don't know the rules of the game that you also run the risk of getting burned by the game. And, again, I can't recommend enough for anybody who is on Medicare or applying for Medicare, whatever the case may be, you really, really ought to be meeting with someone who can guide you in the right direction for that particular one. And with that, then if you have any questions, problems, or anything else down the pike, you have someone who can provide you with clear information, accurate information, and can also serve as your advocate in that particular instance. So with that, what I'm going to do is I'm going to stop now, take a short break, and we'll head back into the final portion of the episode where we're talking about, how do you enroll, and then how much is it? Because then that's going to open the door to IRMAA.
Correct.
Okay.
Yes.
And so stay tuned. We'll be back with you in just a few moments.
Do you keep up regularly with your investments? Where exactly are your hard-earned dollars going? Are you financially prepared for an emergency?
I'm Mike Menninger, founder of Menninger & Associates Financial Planning. We believe that education and knowledge are powerful, and we want our clients to understand why we are making the recommendations that we make. It's your money, and you deserve to know where it's going, because it's not how much you make, it's how much you keep. So call us today to discuss your financial concerns. Welcome back to Financial Plan and Explain. We're in our final segment of Medicare with Cheryl Lagunilla. I struggle with it. So anyway, my apologies. But the long and short of it is now we're in the final segment. We're going to be talking about how do you enroll? Now that you're eligible for Medicare, or now that you have retired, you're 67 years old, you had coverage, but now you're going to be applying for Medicare. How does one enroll?
Well, this is the interesting thing is most people intuitively would think, look, go to Medicare.gov. But like we said early in an earlier episode, you go through Social Security. Part of that is because they can verify everything. They are the front door. So you go in, and I highly recommend to everyone to already have a Social Security login long before this point comes, because it makes everything go smoothly. There are 3 ways you can apply. You can apply online. That is the easiest and most desirable. You can also apply in person, or you can set a phone appointment.
Mhm.
But the easiest is online. So you go
SSA.gov.
SSA.gov. Correct. You go into SSA.gov, you log in, you're going to use ID.me or login.gov. You get in there, and believe it or not, it's a 10-minute process. Very easy. If you are someone who has worked past 65, it has to send in the employer proof of coverage, the creditable coverage form. You can upload it right there. You're done, 10 minutes. And I suggest you do it sooner, not later, at least, just in case more documentation or some snag happens along the way.
Or you can call.
Or you can call. I suggest calling local. There is a national number, 1-800-772-1213, but do be prepared to be on hold for a considerable time. I like dealing with the local Social Security offices. What?
I didn't know you could actually call the local office.
You have to dig for their phone number, because usually if you look up socialsecurity.gov, you get the national number. But if you can get the local number, you can set an in-person appointment or a phone appointment. Just a forewarning, a lot of times they schedule those phone appointments to enroll you 7 weeks out. So timing is everything.
Right.
No.
Right.
Not waiting to the last minute, and sometimes that will happen, but not waiting to the last minute can save you stress.
So I don't know if you've ever had this happen to you before, but it has happened to us a lot of times. We've had clients call in to Social Security effectively to set their appointment for Social Security, not Medicare, but the two can go hand in hand. And they spoke to the representative on the phone. And I can give you, I used to be able to whip out 5 different ones, but I know right off the top of my head, 3 different times where the person on the phone gave them wrong information. But when they set the appointment, and the one literally got wrong information 2 separate times from 2 separate people, and I was beside myself because it really made me question my knowledge of the Social Security system. And I said, I'm going in there with you. I went in there with you. We sat down with Mrs. Whoever, okay? And she says, I see that you've called Social Security on 2 different occasions, and they provided you with inaccurate information. The people that you have your actual appointment with know their stuff. The people who you're calling on the 1-800 number, be careful.
Yes.
It's not gospel.
It could be a new person in a call center. It could be a number of things. What I find is if you have somebody that lives in your hometown, someone local who goes into an office every day, my experience with my clients is they get better service for sure.
Oh,
and
for sure.
People that are more vested in them. When people have hit walls and things aren't going right and they didn't get their Medicare and now they're trying, they applied for next month and they're told it's not going to be for 3 months and they're stressed. They don't have insurance. They call and they get that one person that really does want to help them, gets everything put through, and it's always the local person.
All right, well, it's good to know.
Do that. Yeah,
that's good to know.
It makes a difference.
I didn't know that you can call locally. And the only problem that I say of going to the office is it's first come, first serve. You take a number. I've heard people there for a good couple hours. If you place the call, and I'm talking about the Social Security side, but I would imagine Medicare is the same way. If I place the call on July 1st, July 15th, or July 31st is the same day, effectively, because it goes by month. And if I placed the call on July 30th and my appointment wasn't until September, it doesn't matter. I placed the call in July. That's when I'm officially in the system. Work the same way with Medicare?
Yes, it does.
Good. So the cost, all right, and I'm going to pick up the IRMAA discussion. So the cost of Medicare Part A is free.
If you contributed, yes.
Right, if you could rent for the 10 years or the 10 years or more.
Can I put up one more thing on the contribution? We have a lot of clients whose wives stayed home with the kids, worked for herself, small business, whatever, but didn't contribute. As a spouse, either spouse, if your spouse contributed, then you are entitled to Part A free as well, as long as they did as well.
Right. Okay. And it's similar work for Social Security, except your spouse has to begin collecting Social Security. In this case, let's say it's a spouse who turned 65 and the spouse who's working is 62. As long as the spouse who's working doesn't have to be on Medicare, as long as they're eligible for Medicare, then the 65-year-old spouse can get it.
Correct.
All right.
Yes.
That's what I thought. So the cost for Part A is free. The cost for Part B is $203. Part D is medical, prescriptions,
Yes.
which is also zero. And then you have the Medicare supplement, okay? And that could be Medigap and Medicare Advantage or something. That's usually $150 to $200 a month based upon the coverage.
Yeah, and your zip code. Yeah.
All that stuff. Let's circle back around to Part B and D, okay? As I pointed out, Medicare is effectively the daughter of Social Security. I used to call it sister program, but it's really the daughter program. Doesn't matter, right? So both programs are the government, okay? And so what happens here is if your income exceeds a certain threshold. Now, defined income is what's referred to as modified adjusted gross income, which is basically your income, your adjusted gross income plus any tax-free interest that you might have gotten. Okay. So if that exceeds a certain threshold, which right now today is $218,000 for a married couple, $109,000 for single. If it exceeds it, the cost of Medicare goes up by about $100 a month per person, okay? So in other words, if I go, and by the way, it's cliff, unlike the taxes where that which is above is what gets taxed, IRMAA is a cliff, okay? And it's IRMAA, which stands for Income-Related Monthly Adjustment Amount. So if I break through $218,000, then each spouse who's on Medicare is subject to roughly an extra $100 a month. And that's if you make $218,001. Bang, it's costing you $100 a month is basically $1,200 a year per person. That's $2,400 for breaking through by $1. And I always like to say, which is awfully darn true, IRMAA is an acronym, Income-Related Monthly Adjustment Amount. By the way, I call it Income-Related Monthly Attitude Adjustment because it requires an attitude adjustment once you find out you're paying it. Anyway, if there is an exchange of money between you and the government and it's associated with your income, I have a different acronym, TAX. It's a tax, okay? And trust me when I tell you, a lot of stuff that we do in tax planning for clients, particularly as they're approaching retirement age, that is another tax. It's almost an overlay on top of the tax system because the moment you're breaking through $218,000 or half that, which is $109 for a single individual, as soon as you break through, it goes up. And then there's another threshold that goes up more. Then there's another threshold that goes up more. So we look at the tax brackets, you got the tax brackets, but now you got IRMAA as an overlay right on top of it. And trust me, it's a tax and you need to take that into consideration. What's also interesting about IRMAA, which by the way, I like to say is, we all don't like Uncle Sam, right? Guess what? I refer to her as Aunt Irma, right? If you don't like Uncle Sam has a sister. That's Aunt Irma, another tax. I'll let you use that if you want. So basically what happens is that when you go on to Medicare or when you're on Medicare, the determinant of your income is actually, let's say it's 2026 right now. And let's say I'm going on to Medicare because my brother, okay, he's got a job, but let's just say he's going on to Medicare. So what they're going to do is they're going to say, okay, how much are your Medicare premiums? What they do is they look back to your income from 2 years earlier. And if his income was $400,000 2 years ago, they're charging Medicare premium based on being $400,000. But I shall point out, there are reasons that you can appeal it. Okay.
Yes.
One of those reasons may be, which is typically the case, one of the reasons is if you have a reduction of income due to reduced hours, retirement, or whatever the case may be. So in that particular instance, if he made $400,000 2 years ago, but he's retired and now he's on Medicare, then it's like, well, you're due for premiums based on 400 grand. You get to do time out and appeal and say, no, 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 no. Like, oh, really? You qualify because you have reduced your hours or whatever the case may be? Well, guess what? Oh, then what's your income going to be this year? And you tell him what your income is, and let's say it's 200,000. He's like, oh, well, 200,000? That's under the threshold? Cool. You're not getting IRMAA. But this is one of the few cases where the left hand does, in fact, talk to the right hand with the government, is if I told them, no, my income's not going to be over 218, it's only going to be 200. If all of a sudden I cross the $218,000 threshold, guess what? They're hitting me with it for my taxes at that time. So just know that it exists, and there are opportunities with which you can get a reduction. Now, once you're on Medicare, and how do you pay for it? Well, if I'm on Medicare but not collecting Social Security, well, it's the mother-daughter program, I can be on Medicare but not collect Social Security. A lot of people say, look, I don't want to collect Social Security until I'm 70. Or they're 65 years old, and it's considered early retirement. If they collect Social Security, they're limited to only like 24 grand a year. They may say, well, look, I don't have medical coverage, but I'm going to be making more than 24,000. For whatever reason, they're not collecting Social Security. Basically, then what happens is they're paying quarterly, right? They get an invoice from the government.
An invoice quarterly, yes.
Right. Otherwise, it ends up being a reduction to your Social Security. So let's talk about most people who are on Social Security and Medicare. What happens is typically right around December 1st, they get their letter in the mail from Social Security, which I always ask people, save that letter, please. So they get their letter somewhere on or around December 1st, which basically says, okay, dear Mr. Smith and Mrs. Smith, 2 separate letters because it applies each. This is how much your Social Security will be next year gross. This is how much your Medicare will be, $200. And then this is how much we're going to withhold for taxes. And oh, by the way, this is how much IRMAA is. Okay. And go to the next page and it'll tell you, well, your income was this much, and these are the different tables, and this is why your IRMAA is this. But it also gives all the reasons why you may be able to appeal it. And as I pointed out before, we do routinely tax planning. And I want to say I hate IRMAA because of the fact that 218,001
yes,
just cost me $2,400. Whereas if that was a tax bracket and it went over by $1, that's an extra 8 cents on that dollar. 8 cents is cheaper than $2,400. Breaking news.
Yeah, I didn't know.
So anyway, I would like to take this opportunity to also plug, and I cannot plug enough, Cheryl. She's the person who I've met in my life who knows the most about Medicare, really cares about the people. I am not about to talk about age at all, but certainly closer than a 30-year-old. So I am telling you, you're over 30.
I'm
okay.
30.
Right. And so am I. Okay. But what really makes a difference to me, and this is how I do business, is likes to educate, cares about the individual, and wants to help. And when you've got somebody like that and who has the knowledge, let me tell you, you got to take advantage of it. And how do you get paid?
As a Medicare agent and regular insurance, we make commissions when we get someone a carrier, a product, Advantage, Medigap. But we're also obligated to tell people how many products and carriers we represent and how many are available and where they go, Medicare.gov, to find out more about the ones we don't represent.
Right.
So
But the
transparency. But I get paid by a
Right.
commission. And because I'm getting that commission, to me, the obligation is I'm making money from this. That's, it doesn't stop just because you got
I
the
fully
plan.
understand that.
Yeah.
And the reality of it is that, and this is what a lot of people ask me, they could do it themselves and it's not costing them any less. It's not costing them more money to use a consultant and an expert like you.
Yes, even though we don't give a fee when they get the product that we make a commission off of, it would have still cost them the same.
That's right. So if it's costing them $200 a month, it's going to cost them $200 a month regardless. If you get the product using Cheryl and her knowledge and expertise, it's still $200 a month. She gets a really small piece of it. I won't go there, but I just know that it's not a lot of money. But if you could do me a favor, take just a moment, look in the camera, and tell people how they can get a hold of you.
Again, Cheryl Lagunilla, and my company is Focused Health Access. My website is the same, focusedhealthaccess.com. Email hello@focusedhealthaccess.com, 610-306-5353.
Is hello your nickname?
Yes, it is.
So anyway, Cheryl, thank you very much for doing these episodes with me. That was terrific.
Oh, thank you for having me. I appreciate it.
It's my pleasure. And I hope that everybody viewing and listening had the opportunity to learn something and can apply it either to themselves or to folks they know. So thank you for joining us. And if you have any questions that you want to reach out to us, because I touched on some of the tax planning that we do as it pertains to IRMAA and everything else, we could be reached through our website, which is www.maaplanning.com. That's Menninger and Associates, how creative, maaplanning.com. Or our phone number is 610-422-3773. Thank you very much for joining. I hope you have a wonderful day and a wonderful week, and we'll see you next week on Financial Planning Explained.